Welcome to Dr. G at the Heart of Healthcare. We are here with our friend from the community, Jason Swisher, the PT physical therapist and owner of Coastal Mobile Therapy. Welcome.
Thank you. Thank you for having me on the show today.
It's so exciting. We met a month ago or 2 months ago, and then we were like seeing each other back to back at a bunch of networking events, right?
Yeah, like every other day almost, it seemed like for a little while there.
I know. I feel like we became besties. So had to have you on because here we try to help people navigate the healthcare system. And a lot of people know about physical therapy when they're on home health, but a lot of people don't know that if they're on palliative or hospice, especially, they can also get physical therapy. So I want to make sure we talk about that whole continuum of care. So the title today is Physical Therapy During the Late Stages of Life or End of Life. So tell me how you came about owning your own little company, and it's a mobile company. I thought you guys, I don't know, I really don't know about your world too much, I guess.
Well, it's interesting you said that because I don't think very many people are super familiar with mobile options, and they usually automatically associate it with home health. And we are similar to home health in that we do go to people's homes to do treatments, but we don't encompass nursing and social services and all the other um, pieces that go into that puzzle for home health. We are strictly physical, occupational, and speech therapy. And we treat patients in their homes as long as it's a non-skilled setting. So that would be your home, an assisted living, a board and care, somewhere where you don't have 24-hour nursing that is handling cases for patients or residents. So we focus on trying to make sure that the people um, who we are working with are improving in their ADLs, which I know you're going to probably talk about a little bit later, and trying to improve their function and safety at home so that they can live a better life at home, a safer life at home, support their family better, have that ability to help their family members if they're being taken care of with somebody, and be a better participant in daily life. That's our goal, and to do it in a safe way.
That's good. Because we've talked a lot here during this season one that for seniors, their functionality is their most important resource. They want their independence more than anything and to be
Mhm.
able to get around and move around. So I'm glad they have that service, just set it, alone by itself that you provide that in the community. My son is actually in physical therapy. A lot of the listeners know that he's in the NFL. He just had a recent surgery on his knee. So a lot of people are familiar with that kind of physical therapy.
I've been there, done that,
You've been in
unfortunately,
the sports
on a
world.
personal level. Yep.
Oh, yeah. Yeah, but we want to keep our seniors, and those, in hospice and other places also with their function up. So let's just have a refresher of the activities of daily living. There are six of them, listeners. Think about what it takes for you to get to the breakfast table in the morning. You wake up in the morning, you have to get out of bed. So transfer, ambulate to the bathroom, use the bathroom and clean yourself appropriately, do your cleaning, your showering, and all that stuff, and get dressed, and then get to the table and feed yourself. So, those are six things that are really important. There's instrumental activities of daily living that are lost when folks are losing their memory. They may have dementia or things like that. But the activities of daily living, just those things you need to live in a house. Those are the things we're talking about today. And I want to point out that the conditions of participation for hospice includes PT. If you all recall, when we were talking about the interdisciplinary team, non-core members, the hospice aide, we mentioned this and how physical therapy, occupational therapy, and speech and language pathology were all services that should be provided. And what's the language here? Pathology services must be available and when provided, offered in a manner consistent with accepted standard of practice. And Jason here knows what the standard of practice is. We don't. That's why we would, contract with someone like him to help us give our patients what they need. And so I want everyone to know here, if you have a family member on hospice care or palliative care or something of that nature, you can ask for it so that they can maintain their functionality in their ADLs, or maybe you can get some help with doing things right, Jason,
Yeah.
when they're
Yeah.
bedbound?
I think, and you're hitting it right on the head there. I think that for a lot of people, they don't think of therapy and hospice in the same conversation.
Hmm.
It's not the first thing that comes to mind. It's usually going to be nursing or something of that nature, which is understandable and very important. But therapy can certainly aid in that comfort and peace that we're talking about for a patient at home, especially a hospice patient, where they want to be able to enjoy it to whatever degree that they're able, their daily living, and to functionally go through those 6 ADLs that you brought up, the building blocks of your day, basically. You need to be able to do all of those, and if you can't do them independently, you want to be able to do them to the highest level that you possibly can. Any one of those changing alters the scope of what kind of care you're going to need and how much input other people are going to have to be involved in your daily care. And that often includes family members. And, sometimes it's in the form of paid care. And of course, with hospice, there's representatives helping as well in that area. But ultimately, you're bringing in extra help, and so you want to be able to support that help in that regard by being able to do the best for yourself that you can. And we feel like
Hmm.
therapy, often viewed more in a rehab context, which it certainly is, and progressive training and things of that nature, which your son would know all about, definitely has its place. But in this area, in this scope of life that we're talking about in the aging population, as we age, it can come in different ways in different places. And it certainly has a place in maintaining and preventing further loss of function, as we look at that scope.
Yeah. And sometimes we receive patients that have fallen, maybe they were independent, and the family is so shocked how their loved one has suffered a severe clinical decline after falling, breaking a hip. We know seniors are at risk for that. And so we want to make sure that folks like that are able to regain their strength as much as they can. And also, I want to point out this article that we looked at earlier today, right?
Yeah.
This is an article we actually touched on one of their blog posts before from the Ann Schutz palliative care blog. And the title of it is The Assessment of the Effects of Multi-Component Individualized Physiotherapy Program in Patients Receiving Hospice Services in the Home. And I just want to get to the bottom line, which said that it was highlighting how we need to have a continued practice of allowing the physiotherapy referrals for incoming hospice patients for whom rehabilitative services are an important part of maintaining quality of life for as long as possible. So that's back to our goals of care, right? Obviously, certain people are beyond the scope of, getting their strength back, but some are not. Like I mentioned, someone who may have fallen and just 2 weeks ago they were living by themselves in their apartment, and now suddenly they found themselves, you know, with a PPS of 40% because they fell. Or maybe someone, I had a recent patient, they suffered a heart attack and received no intervention. So they were having a really high oxygen demand and they were really fatigued. And so they needed that rehab because it was just sudden. It was an event that put them on hospice care. So they certainly benefit from that, regaining their ADLs. And folks who are falling a lot. So, what did you think about the article?
Well, I thought it was very interesting. It looks like it's about a 4-month period that they they monitored and followed 60 different home-based patients, and the average age is around 65, 66. So there's your Medicare population right there. And quite often your hospice population probably kind of getting into that area as well. But, really it hit home in every category that they discussed, ADLs being the first and most foremost with that. Every single category shows improvements. And, obviously you could break these down very scientifically to every single percentage, but there isn't a single category that didn't show improvement. And some of them were pretty significant. And, when you're looking at an age group like this, one thing I think you and I both know very well is it doesn't take very long to have something go backwards. If somebody starts to have an event like you're talking about, you can lose your function and strength in a matter of just a few days, where somebody is
Sad.
going from seeming, fairly functional to being completely immobile in a very short period of time, depending on what that event is. And sometimes even just from not having the opportunity to move more, be social. We always like to talk about the social component. It gets left out a lot,
Hmm.
because how is that physical therapy? But it certainly is. And we saw that a lot during COVID, with a lot of our facility-based patients. They didn't have the opportunity to have that consistency, and the buildings really saw a dramatic difference in those few months where, it was, we, for a little while, physical therapy, just to back up a hair, was not considered an emergent service at that time, or, that was required to be in the building. So it took a little bit for them to kind of get us in the door as well, along with the physicians and nursing. And during that time period, there was some lost days, some lost weeks, and they compiled very quickly, in addition to all the other issues that people were dealing with at that time. But it did not take long for that population base to slip very quickly with those ADLs and their function and safety, ultimately,
Mm.
unfortunately.
Wow. We
So
suffered
I
so
really
much
like this
loss.
study. Yeah, it
Yeah.
shows, it's a reminder that every component of your health is important. And if you leave a portion of it out, you're going to be missing something somewhere. And their physical movement is definitely a part of that, along with the medical and the social.
I love that. Like, I envision, I hope people listening don't get mad, like the higher ups, but I envision physical therapy being a part of an interdisciplinary team in hospice because what I'm documenting when someone comes on, the first thing I'm documenting is their functional status. Like what's their PPS, their palliative performance scale? How many ADLs are they dependent in? And all that. Like that's the most important thing. And it seems like having your expertise there and even providing education for the caregiver on moving the
Hmm.
our patient properly. Seems like all that stuff is important, and I hope that the listeners here. The point of this is to empower them and educate them so that they know where to find you and they know that they can ask for it. So I hope they get that from having the link to this article in the show notes and the conditions of participation for hospice care and also your website.
Yeah.
Yeah.
www.coastalmobiletherapy.com if you're in
Yeah.
San Diego County. But you're
Coastal, and I
absolutely
love that.
right. You're right. Empowering everybody to know what their options are is the first and most important part of healthcare for everybody. Whatever level they're working at it with. Like you said earlier, the hospice care has that availability to provide therapy as needed. And it's something that I think is a great supporting piece to the medical side, because if we can help the physical stay functional while we're treating and working on the medical together, you can get that person hopefully in a more comfortable state where they're keeping their function higher. Maybe we're reducing pain levels, and we're certainly taking the burden off of the family that's involved, that's trying to figure out what their next steps are. It's very overwhelming, as we both know, for people going through these episodes.
Yeah, yeah. Well, thank you for being here, Mr. Surfer. I learned that you're a surfer, you're a sports dad. So we have all
Oh,
that
yeah.
stuff
Mm-hmm.
being here
It
in
keeps
San
us
Diego.
very, very busy, doesn't it?
Yeah, yeah. Well, thank you for educating us on your area expertise. Maybe you could help the listeners understand how does one train for to be a physical therapist? Like, what does that look like? Maybe we can end on that before we move on, so that people understand the importance of your role in healthcare.
Sure. Yeah. And it's a role that's in every area, of healthcare, whether you're outpatient, inpatient in the hospital, geriatric, pediatric, rehab, like your son's working on high performance. We're in all those areas. And the main thing with therapy, if it's something you're interested in getting into, I would highly recommend trying to get in a situation where you can shadow and observe and see a setting that kind of clicks with you, something that you can identify with. And sometimes it finds you. I thought I was going into this just to do sports. That made a whole lot of sense to me. I was interested in training. I even did a shadow day with the Seahawks up
Oh,
at their old camp in Kirkland years
we
ago.
beat them this week. We beat them
Yes, you
this
did, but we're
week.
not going to talk about that. That was just
Oh, this
first
is
week, first
perfect.
week jitters. I know, Miss Rams fan. But for the listeners out there, I grew up in Washington, so that's the connection there. But it was very cool to see all the busyness, the activity, but also to understand that there's only so many of those kind of positions available. And the trainer at the time there said, "Hey, you know what? We love what we do, but there are only so many positions like this, and I would highly recommend that you get that full scope education, get your physical therapy degree. You can still be a trainer. You can still work with this level of clientele, but it will give you more options. It will keep your doors wide open." And so that's what I went into initially. That was my initial fall in love moment. But as I kind of got further into it and I learned more as I went along, with my career, I started finding this need, this gap that was out there, that we were, you're having home health, you're having inpatient, you're having rehab facilities, and then somewhere between home health, which was still a little bit newer at the time when I came out several years back. Um, Home health was still a little bit on the newer side. And then you had this wide open gap and you had outpatient clinics.
Hmm.
And outpatient's great if you're, in a very high functioning level age and you don't have any issues and your ADLs are spot on. But if you're not driving anymore or you're needing help with some of those areas, it can suddenly become very, very difficult. And we would see a lot of people in the outpatient settings canceling their appointments and not showing up and things of that nature because it was extra work to get there. Maybe they had to set up a ride. Maybe a family member wasn't able to take them at the time and things like that. Or just the inconvenience of having to leave their home and go somewhere, and they just had been back from a hospital and they really didn't feel like going somewhere else again. And so you had a lot of compliance issues where you just didn't see the consistency that you need to see if you want to make improvements. So for us, bridging the gap between the mobile side of home health and the brick and mortar side of an outpatient clinic made a lot of sense. There was a big space there, and we jumped into it. And there are a lot of other companies like us. We're not the only ones out there, but for our area here, we're very proud to say that we were one of the earlier ones, and we've really enjoyed what we do.
Awesome. Well, congrats on all your success. And I love how we are adding value to the community. And I'm not trying to toot our own horns, but it really feels good to make a difference in the community and add value with these things. So thank you for being a
Absolutely.
guest at the
And
Heart
thank
of
you
Healthcare.
for including us in your space and bridging that gap, because that's another area, a lot of people don't think of. So I really appreciate that.
Oh, so glad you were here. So thank you, Jason, and
Thank you.
we'll be in touch. Peace, everyone.
Bye bye.